Hello, everyone. I'm Dr. Himani. I am a developmental behavioral pediatrician, a co founder, and a director at Continua Kids. And today, our topic of discussion would be causes and intervention that can be done for self injury behavior in children on autism spectrum. So, we all have been discussing about various issues over the last few months on various challenging behaviors in children on autism spectrum disorder. And self injury is reported to be one of the very challenging behaviors when it comes to managing our children on autism spectrum. So it's important for us to understand here that self injury is not a symptom of autism. These behaviors, injurious behaviors, they occur because of certain situations. They can occur because of certain comorbidities which are related to autism spectrum, and keeping those in mind, we are going to plan how we can intervene in such situations, right? So we also need to understand that our children on autism spectrum disorder do have some amount of communication difficulties because they are not able to express their need in words. They are not able to communicate with us. They start to figure out some coping skills or some mechanism by which they can attract the parents' attention or the caregiver's attention towards them. And self injury can be one of those behaviors which the child is having so as to get that attention or that uh, attention of the parent or the caregiver. So, lack of communication, frustration due to lack of communication, anxiety because of various reasons could be some of the factors leading to self injurious behaviors in children on autism spectrum disorders. And these behaviors can at times have long term harmful effect and impact. That is why it is important to learn how to treat these behaviors. So, what some of the very commonly observed or reported uh, physical self harm behaviors in children on autism spectrum would be scratching, pinching, biting, or slapping, or sometimes even banging their head. So these are sometimes they tend to chew onto their fingers and their body parts. So these are some of the self injurious behaviors which are mostly commonly reported by parents for children with autism. So it is very important now for us to be able to analyze why a child is having or displaying this self injury to themselves. So, one, as we discussed, could be lack of communication skills. When the child is not able to convey their feelings, their ideas across, or they are not able to express themselves in words, then they can start biting you or pinching you or sometimes even banging their head to get your attention. Or sometimes it could be uh, a fear or a pain or some kind of a displeasure that the child is experiencing. There could be anxiety which the child is not able to express out to us in words, and those are the areas which can trigger this. Instead of saying I'm scared or I want to get out of this place, I want to go out, I don't want to be here, or instead of saying play with me, or look at me, or the child may just do a self injurious behavior like biting, pinching, banging their heads to get your attention to them because they are not able to use those set of words. So sometimes it could be a physical pain, it could be a pain in the head, or it could be a headache, and to relieve that headache the child will bang their head, because banging makes it feel better for them. So this could also be one of the reasons. Sometimes it could be a dental pain, a pain in one of the tooth which is probably decaying, which could lead the child, because they want to overcome that pain, they inflict another pain, and that makes them feel a little better of their existing pain, so they can bang their head. So whenever we are thinking of a self, or observing a self injurious behavior in a child on autism, we have to start figuring out a cause for it. Why is it happening? What is it probably that the child is trying to communicate with us? Sometimes this self injury could simply be a form of sensory stimulation. The child would need a bigger amount of sensory input to have that kind of an arousal to a surrounding environment. So to have that arousal, the child will inflict some pain to be able to arouse themselves sensorily. So sometimes self injury can turn into a learned behavior, because the child has been engaging into self injurious behavior, and unintentionally, as parents, as caregivers, we tend to sometimes reinforce those behaviors. What happens is the child engages in a self injury behavior, and the parent or the teacher probably hands them something that they desire or that they like to calm them down, and that behavior gets unintentionally reinforced by the parent or the teacher. So it could be an unintentional reinforcement by us sometimes. So we have to be very careful of the consequence that is happening after the child inflicts a self injury. Sometimes the parent immediately removes the child from that overstimulating environment, where the child is trying to self, like if the child walks into a clinic and in front of the doctor the child is trying to pinch the parent a lot more, or trying to slap, or trying to hit a lot more often than the child would actually do it, sometimes out of embarrassment, sometimes out of trying to calm the child down, the parent may walk out of that room with the child, and the behavior gets reinforced because the child knows that was an uncomfortable situation or social scenario for me, and when I did a self injurious behavior, or injuring the other person also, sometimes I was removed from that uncomfortable situation and environment, and unintentionally we have reinforced that behavior. Thereby, slowly, when this keeps on happening again and again, the children, they tend to learn the behavior, and the behavior keeps on getting reinforced, and then they learn it. So then it becomes without purpose also, that without a cause also. So for the parent or the caregiver, it is important for us to actually understand and try and decipher as to why that particular behavior is happening, and is it associated with some kind of a positive, is there a goal behind that child having that kind of a behavior. We need to understand the cause first, and then try and treat those behaviors after understanding the cause for it. So typically, if the cause is that the child is not able to communicate with us, then we would somewhere start finding out the ways to help the child communicate with us in an alternative way. So instead of biting, we need to teach the child an alternative way to communicate. Maybe use a picture card, or use another method to communicate. So you need to replace that self injury with another method for either communication, or you use another sensory stimulus. If the child is seeking that painful input or that injurious input for a sensory stimulation or arousal, simply for arousal, then you need to replace that with another kind of a sensory input which probably will ease out the child's sensory desire and will somewhere reduce the seeking of that injurious stimulus again and again. The other thing that the parent can start working on, they can maintain a journal of the frequency of these behaviors, whatever xyz the behavior is, whether it is inflicting an injury to them or to a caregiver. They can simply maintain a journal of the instances when that episode happened or when that behavior happened, who was present, what occurred immediately before the behavior, and what occurred immediately after the behavior. How did other people in the environment react, respond to that behavior? Did the child get uh, to avoid or escape from or leave from a difficult situation at that time? So those written records that we'll have will be very reliable uh, than the emotional memory probably that we'll have of those episodes as to why and how and what happened around that self injury. So try and start maintaining a journal, then defining the behavior using specific language as to what kind of a self injury was the child inflicting, or any kind of an injury the child was inflicting to somebody else. Then analyze that information: when, where, how the behavior occurred, what was the consequence, what were the people around in that situation when it was happening. Try and identify the reason or causes for the same, making, and once you know or analyze the reasons, you may just hypothesize. It is possible कि हर बार आपको एक specific reason ना मिले. There is a good possibility that you may not be able to find out the exact reason, but you'll have, okay, maybe this was the reason, maybe that was the reason. So that means आप hypothesize कर सकते हैं एक reason को लेके, and for that behavior, and you can start trying to work on that cause, or you can figure out what the child was trying to communicate at that time, and then you can figure out, make a plan to address that situation. Specific actions and interventions can be used to improve the behavior and reduce the triggering events. So once we know what triggers that, we can reduce the triggering events for the child, instead of putting the child in a situation and then taking them out when the behavior happen. There the behavior is getting reinforced. But if we are trying to avoid the situations where that behavior will happen, avoid in the sense we are not exposing the child, we are reducing the frequency of those situations, then also the behavior will not happen, and gradually that episodes will start reducing. So most important thing here is to teach the child to communicate. It's very important that we help the child to allure their anxiety, उनका जो भी discomfort है in certain situation. अगर आप उनको counsel कर सकते हैं, if they understand, comprehend little, you can sometimes use social stories. You can start priming them. Social stories में क्या होगा, you will take up a particular situation in real life, and in priming you will expose them in small pieces and parts to that kind of an environment which they are uncomfortable in, or that kind of a situation where that they are not very comfortable in. Or you will prime them, okay, we are going to go there, and this is all what is probably going to happen. There's nothing to worry, we are going to have fun, we are going to enjoy, we are going to be there for this while, we are going to talk to the person and then come back. So this is priming, probably telling the child uh, where you are going, what you are going to do, what they are going to experiencing. Social stories also give them a third party view of, okay, that xyz person went in that situation and this is what that person experienced, and so they have start getting an overview of, okay, this can happen in such situations. So then the child will be less anxious, and the child will be more prepared emotionally to be in that situation, and so their chances of probably getting anxious in that particular challenging situation will be much less. It will be more predictable environment for the child, and so challenging behaviors like self injury will reduce. Teaching an alternative behavior to replace the self injury is another way to manage it. So you can teach the child an alternative behavior to help them get their wants and wishes. So if they want their wish to be fulfilled, instead of self injury, you tell them another way to address or to demand for whatever they want. Uh, Such, for example, escape will not work. So instead of that, teach them to say leave, teach them to say stop. Single words you can use. If the child understand or can speak more, then you can teach them a certain sentence or a phrase to be spoken in that situation, so that they can express their need. If the child is not verbal, then you can use a picture card, teach them to use a picture card of stop. So whenever they'll use the picture card of stop, the person will stop there, or that means that they do not want to go further in that situation. So we are trying to replace the injurious episodes with a either a flashcard which says stop, or a flashcard, or the verbal response. We are going to teach the child to say leave me alone, or go, or stop. So things like that we need to replace. This is called as teaching an alternative behavior to replace the self injurious. Then it's important to remove or alter the triggers. So what happens is that the trigger which is triggering that situation can be altered. If, let's suppose that the child is triggered to do self injurious behavior, if they are made to do a certain kind of a drawing or an assignment where they have to write, like homework task or a writing task is too frustrating, the child is not motivated to write, and as a result of avoiding that situation, the child starts hitting, biting, pinching. Now what we'll do is we are going to reduce the difficulty of that task. You can reduce the time of performing that task, you can reduce the duration for which the child is going to get exposed to that task, and you can also work at reducing the difficulty level of that task, right? So make it simple, break it into parts, make it simple, give them in parts, give them, make it simple, and then offer them the task. That is what will help the child to gain confidence, and they will then start reducing, because then they'll be motivated, because they'll know it's going to happen only for a short while, and if I finish, I'm going to get reinforced by my parent, and the child will try to finish the task, and the self injurious behavior will be reduced, because now the same task is less challenging, right? So these are some of the ways you can use, and when their frequency of self injury is less, you can reinforce the child by telling them that you behaved very well, you did well, so that's a good job, high five, and those kinds of reinforcing attitude can be displayed to the child to help them overcome those behaviors, and to help them motivate those kind of challenges. Now, when we are addressing these self injurious behaviors, we must never forget that a child can have a physical ailment which is causing some amount of pain to them. That ailment could be a toothache, it could be a headache, it could be some pain somewhere, it could be that the child is having some nose block or has not been keeping very well. So in that situation, sometimes those self injurious behaviors tend to get triggered. So that is where we need to work at reducing their medical symptoms or causes from medical origin. If they are gassy, if they are constipated, if their bowel is not clearing, if they have pain somewhere, so all those causes we must treat them, treat their physical ailments. If you identify any, always keep your eyes and mind open to the fact that child can have a physical cause also for a sudden increase in self injurious behaviors. Anxiety again is a very important reason which can trigger self injury. So there again we need to find out ways and means to relax the child, to and reward their positive behaviors, prime them to enter the situation that reduces their anxiety. And all these techniques can help you to reduce their self injuries and to help them stay calm, to help them be able to cope up with these challenging behaviors. So that is all I think from our side today. Now we'll take up some of the questions which are there in the chat box. So Lorena is asking, hello, my son runs so many times to TV and go back to sofa. He knows all the animals, numbers, alphabets. He speak little words and he answers to his name, but he have speech delay. Do you think this behavior, running so many times, is a symptom of autism? Thank you. So, Lorena, it's very important that a child on autism spectrum typically can be verbal, they can have a lot of vocabulary, but we also need to evaluate the quality of communication that the child has. Now, the child has vocabulary, but what is the quality of communication, verbal communication that the child holds? Is the child who is, I don't know the age here, you haven't mentioned the age, Lorena. So if the child can speak all those words, can the child ask, Mama, get me a glass of water? I want to go out and play. I wish to eat a banana. So those kinds of uh, uh, sentences or verbal communication where the child is able to express their need, is able to express their emotion, is able to hold a social interaction well. So those symptoms need to be looked at, because many children on autism have excellent rote memories, and whatever they learn, they see, they hear, they tend to memorize it. And that rote method of speech can be observed in them. Running in patterns from one end to another can be a symptom of autism, but one single symptom cannot define autism. Autism is a gamut of challenges where a child will have social communication delays, the child will have repetitive interest behaviors, activities, the child will be restricted to certain patterned set of activities and behaviors. So we need to keep into mind those umbrella of symptoms when we diagnose. So if your child, you experience all those challenges along with excessive running in patterns and lack of communication, then you must reach out to a developmental expert who can help you and guide you with a right diagnosis and then probably the right set of interventions. Okay. ओके हिंदी में बोलना है. So next, Shubhada, I will speak, take a session in Hindi next time on a similar topic. I'm trying to reach to that level where I can communicate everything perfectly in Hindi. So जब but आपके लिए briefly मैं समझाऊंगी कि जब भी बच्चा खुद को मारता है, जो कि पिंचिंग के फॉर्म में हो सकता है, स्लैपिंग के फॉर्म में हो सकता है, या बाइटिंग के फॉर्म में हो सकता है, या हेड बैंगिंग के फॉर्म में हो सकता है, आपको सोचना है कि इसका कारण क्या है। बहुत बार कम्युनिकेशन मतलब अपनी बात नहीं समझा पाते, तब ऐसे चैलेंजिंग बिहेवियर्स हो सकते हैं। एंग्जायटी है तब हो सकते हैं, और कभी-कभी कहीं पेन है, दर्द है, फिजिकल कॉज़ हो सकता है। सो आप एक डायरी मेंटेन करेंगे, जर्नल मेंटेन करेंगे, जहाँ पे लिखेंगे कि कब-कब सेल्फ इंजरी हो रही है, किस-किस समय हो रही है, उसके पहले क्या हो रहा है उस बिहेवियर के, उसके बाद में क्या हो रहा है, उस सराउंडिंग्स में क्या है, ठीक है? उसका एंटेसिडेंट मतलब उस बिहेवियर से पहले क्या हुआ, उसका कॉन्सिक्वेंस क्या हुआ, और फिर आप कोशिश करेंगे या तो उस बिहेवियर को रिप्लेस करने की कोशिश करेंगे या कम्युनिकेशन पे वर्क करेंगे कि बच्चा उसकी जगह, उस बिहेवियर की जगह कोई वर्ड यूज़ कर सके, स्टॉप हियर। और आप उनकी एंग्जायटी कम करने के लिए उनको प्राइम कर सकते हैं, सोशल स्टोरीज बता सकते हैं अराउंड सेल्फ इंजurious बिहेवियर। अगर कोई फिजिकल या मेंटल या कोई फिजिकल पेन है, तो अगर आपका ध्यान है कि इसके दांत में दर्द तो नहीं हो रहा है, या पेट में दर्द तो नहीं हो रहा है, सर में दर्द तो नहीं हो रहा है, तो उस फिजिकल कारण को हमको ट्रीट करना है, ताकि बच्चा उस बिहेवियर को कम करे। राइट, और उसको कभी भी लर्न नहीं होने देना है बिहेवियर को, ठीक है। Sujata is asking, on this 20th March, we are traveling to India, 5 hours journey in the plane. My daughter is not sitting in one place. Sometime anxiety goes up. Please give me some suggestions. Sujata, traveling, if you are traveling for the first time, then you can already start maybe building social stories around air travel. You can show the child pictures of aeroplane, start priming the child that what all is there on the airport, that we need to sit there, we need to have the in the travel we will have to sit, will you can use some activities which she can do while sitting in the aircraft to engage her purposefully, which are to her choice, maybe her small blocks or toys or puzzles or something which you can keep in the handbag to engage the child. Then social stories, and maybe a round of the airport, showing the child the aircraft, all those things before actual travel can help them, because that gives them an exposure. Second time exposure to a similar environment is less challenging. Talking about it, priming about it, desensitizing the child by exposing them once to a similar situation will reduce their anxiety on the actual day of travel. So these measures I think you can take. ओके, डॉक्टर मोनिका इज आस्किंग, एग्रेसिव बिहेवियर्स को कैसे रिड्यूस करना है? एग्रेसिव बिहेवियर्स में भी आपको यही फॉलो करना है एज टू व्हाट इज द ट्रिगर फॉर दैट एग्रेसिव बिहेवियर। उनका ट्रिगर क्या है, एग्रेसिव बिहेवियर से पहले क्या इवेंट होता है, उसका कॉन्सिक्वेंस क्या होता है, उसे क्या चाहिए होता है, वो क्या कम्युनिकेट करने की कोशिश कर रहा है, ये सब आपने एनालाइज करना है। जब जब बच्चा एग्रेसिव होता है तो आपने नोट करना है जर्नल में कि कब एग्रेसिव हुआ, किस सिचुएशन में हुआ, ने उस सिचुएशन को हैंडल करने के लिए क्या किया। And then you can discuss also with a therapist, with a behavior therapist or a doctor, as to whether this method of mine is correct or not, whether this method is all right, and if you are not successful with whatever method you are using, you have to replace it with other methods, because sometimes, as I told you, unknowingly we tend to reinforce that aggressive behaviors and the child continues to do it. Okay. So, Bandana is asking, does autism be cured? Okay, so Bandana, autism is not a disease. And so far, nobody knows the exact cause of why autism happens. It is considered to be an epigenetic. There are some genetic elements, there are some environmental factors. Genetic predisposition with environmental factors collaboratively lead to symptoms of autism spectrum. So, because we do not know the specific reason for autism, we do not have a treatment which can totally cure it. And moreover, it's a disorder, it is a neurodiversity. So, we can definitely treat, we can help the child learn new set of skills which other children are learning. So, children here on autism will learn in ways which are different from how other children learn, but they can still acquire a lot of skills. So our purpose of treatment is mostly to help the child acquire various skills to make them more and more independent in whatever they do. Pinkyash is asking, my son hitting his own face by looking me in aggressive ways, trying to show me what should I do on that time. As I stop him to do that, he tries to hit himself. So you do not. He's maybe trying to get your attention there. So do not stop him or do not give him that attention when he's trying to what he's trying to seek. The moment you try to stop him, he's getting mother's touch, he's getting your affection, you are probably cuddling him, hugging him, and he's getting all those things that he probably is wanting at that time, your full attention. And that is somewhere reinforcing the behavior that okay, every time I want her attention, let me hit myself. So you have to try some other method. Also note down when, if you are if your child is not trying to get your attention, what are the other situations when he does that. so that we know various reasons for it, and then we modify those antecedent, uh, उसके पहले का और बाद का बिहेवियर हम मॉडिफाई, कॉन्सिक्वेंस और हिटिंग से पहले का सिचुएशन मॉडिफाई करेंगे ताकि वो बिहेवियर धीरे धीरे कम हो जाए. ठीक है. Okay, so Pinkesh has another question. How long ADHD medication dose is given after 5 years? How many months and how many months it starts to work? So, if a child is on autism with ADHD, then the medications are different. If the child is just ADHD and no other neurodevelopmental concern, then the set of medications are different. So, if a child is on ADHD with autism spectrum, then whatever medications you have started initially, the medication purpose of medication is to tide away the crisis. And behavior therapy and sensory integration methods and interventions to take over the challenging behavior and set the child into a pattern of learning. Once the child starts learning, the medications can be tapered, they can be gradually reduced and stopped. Sometimes certain medications cannot be given for a very long duration. In that situation, there can be a change of medications. So, for all the medical aspects where you are using a medication to treat symptoms of ADHD, you must not take the call yourself, because suddenly stopping them can lead to some side effects which may not be aware of. So speak to your doctor, know for how long, which medication for how long to be used, and how it can be stopped. What is the method of stopping? Do we need to change the medication? All that discussion has to happen with your physician or your psychiatrist or the specialist whom you are following up with. Anamika is asking, "Hi, ma'am. My child is 2 years and 10 months. Diagnosis is intellectual." Probably she's trying to write, but not sure. Anamika, 2 years, 10 months. We do not typically make a diagnosis of intellectual disabilities, mostly given after 5 years or 6 years of age when you can perform an IQ test. But before that, if the child is that young and you're confused about the diagnosis, you must reach out to a specialist who can diagnose. And if you already have a diagnosis, then reach out to someone who can advise you on the right set of interventions for your child or support system. Farah is asking, my daughter bites herself and looks at the mark. How should I stop her from doing this? So you need to replace the activity. If she is enjoying the sight of it or the pain, or she's trying to self arouse herself by biting, or and you can try distracting. Again, ABC has to be done. What situation does she bite, and what happens after she bites? So what is triggering her biting, and what is the consequence after she bites? And then managing that triggers and the consequence, we can actually reduce the biting. Whether it's a communication issue, whether it's a arousal problem, whether it's an anxiety, what is it? Which the child is initiating the biting for, right? So all those we need to figure out. Anupama is asking, what should be done when child is having mouthing issue? My child is 5 years old. So Anupama, a lot of time children on autism, they try to explore their environment by mouthing everything around them. Typically, we use our hands to touch and feel and experience an object, but in children on autism, they can use various other sensory methods to explore the environment. So you start teaching them the right way to explore the surroundings, and thereby the biting issue could be also have a look at their dental status, whether the child is having some kind of tooth erupting, or there is some dental issue because of which the child is trying to put things in mouth or trying to bite. And you need to find out where child can explore objects in the right way. And it can be a sensory issue also, so you can actually change. Sometimes excessive mouthing and biting of every object in the environment could be because of some medical and micronutrient deficiencies also. So there you can reach out to your pediatrician to find out if your child has some iron deficiency anemia or some kind of deworming needs to be done. That also helps to reduce those mouthing. So we have to again find out why mouthing is happening, X, Y, Z. There can be any reason, and we need to keep addressing all the reasons one by one. Bandana is asking, how can I control hyperactivity in my son? He's only 3.6 years. Bandana, you need a child who's 3.6 years is all set and ready to explore the surroundings, can be active because they want to reach out everywhere. Have a physical activity schedule, take them to the park, make them cycle around, make them run around and play things that exhaust them, keep the sugar intake in the diet on the lower side, and engage them in purposeful and meaningful physical activity. That might help in reducing. But however, if the child has delay in acquiring their milestones because of hyperactivity, then you must reach out to the doctor and seek the right set of intervention. Okay, so I think that is all for the day, and we have typically taken all our questions. And thank you all for joining us for this live session. And we'll continue with our efforts to answer your queries as and when possible. And we'll try and come up with a new topic every week so that most of your queries and challenges can be addressed through our sessions. Thank you, everyone, again for joining. For any kind of a further support, our contact details are seen in the video. You can reach out to us at the website, or you can reach out by calling us. Thank you and good night. Stay safe.